My friend is an artificial intelligence software developer for Google, and he says I'll be unemployed in 10 years because AI will be so good we won't need human physicians. And recently, GPT, an open AI software, has been replacing the work of many humans in various fields. But let's see what it knows about multiple sclerosis, and we'll see if I'm actually on the chopping block. I'll show you a conversation I had with it about MS with my own commentary, and we'll see how good it really is, and a few guaranteed laughs at the end of the conversation. Good evening. Good evening. How can I help you today? I'm going through a difficult time. I could use a friend. I'm here for you. What's going on, and how can I support you? I was just diagnosed with MS last week. I'm sorry to hear that. MS can be a challenging condition to live with, but there are many resources available to help you manage your symptoms and maintain a good quality of life. If you need any information or just someone to talk to, I'm here to listen. You know about MS? Yes, I'm familiar with multiple sclerosis. It's a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. Symptoms of MS can include fatigue, muscle weakness, difficulty with coordination and balance, and vision problems. It's important to work with a doctor and support team to develop a plan to manage symptoms and maintain your overall health. So right away, we can throw out the idea that this is going to pass the Turing test. Clearly, I'm talking to a computer here. No human really writes like that. Why me? It's natural to feel overwhelmed and ask why me when faced with a difficult situation like an MS diagnosis. However, it's important to remember that you are not alone and there are many people who are also living with MS. It's not always possible to determine the exact cause of MS, but factors that may increase the risk of developing the condition include age, gender, family history, and certain environmental factors. Despite the challenges it presents, many people with MS are able to live full and active lives with the help of proper medical care, support from loved ones, and self-care strategies. So it's almost like I'm talking to a therapist here, but it does an excellent job. And you'll see I sort of ramp up the difficulty of the question, and I'm trying to ask things that wouldn't be the first search result on Google. There's no MS in my family. Like, what environmental factors cause MS? There is still much that is unknown about what causes MS, but some environmental factors that have been suggested as potential triggers include vitamin D deficiency. Low levels of vitamin D have been associated with higher risk of developing MS. Geography. MS is more common in countries with higher latitudes, such as Northern Europe, North America, and Australia, which may suggest that exposure to less sun and lower vitamin D levels could play a role. Infections. Some evidence suggests that certain infections, such as Epstein-Barr virus, may trigger the development of MS in some individuals. Smoking. Smoking has been linked to an increased risk of developing MS as well as a more rapid progression of the disease. I would add as an addendum, this is a very modest effect. In terms of infections, EBV has a strong link to MS, and actually modern evidence really refutes the correlation of other viruses such as cytomegalovirus to MS. It's really only EBV that has a clear and consistent strong link with MS. These factors alone do not cause MS, but they may interact with a person's genetic background to increase the risk of developing the disease. It is important to remember that everyone's experience with MS is unique, and it's important to work with a healthcare provider to determine the best plan for managing symptoms and maintaining overall health. So it's sort of saying the same thing over and over again at the end of every response. EBV, but don't 95% of adults have antibodies against EBV anyway? Yes, you are correct. EBV is a very common virus that most people are exposed to at some point in their lives. In fact, it's estimated that more than 95% of adults have antibodies to EBV, indicating they have been infected with virus at some point. I just said that. While the vast majority of people are infected with EBV, they do not develop MS. Research has suggested that having a prior infection with EBV may increase the risk of developing MS in some individuals. However, it's important to note that there is still much that is not known about the relationship between EBV and MS, and more research is needed to fully understand the link between these two conditions. It's also important to remember that MS is a complex condition with many potential causes, and there is no one single factor that has been definitively linked to the development of MS. Why would EBV cause MS? The exact mechanism by which EBV may increase the risk of developing MS is not fully understood. However, some theories suggest that EBV infects immune cells, leading to a persistent viral infection that may trigger an autoimmune response in some individuals. EBV infection may cause changes in the immune system that make it more likely to attack the body's own tissues, leading to the development of MS. This is definitely true. There's evidence that EBV can infect B lymphocytes and make them immune to T cell regulation. EBV infection may increase the risk of developing MS by promoting chronic inflammation in the central nervous system. It's important to note that these are just theories and more research is needed to fully understand the relationship between EBV and MS, blah, 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 blah. Very good answer here overall. I never had mono though. Having mono, also known as infectious mononucleosis, is not a requirement for developing MS. EBV, the virus that causes mono, is very common and most people are exposed to it at some point in their lives regardless whether or not they develop symptoms. While some research has suggested that prior infection with EBV may increase the risk of developing MS in some individuals, it's not a requirement for developing the condition. That may not be true. Some studies show 100% seroprevalence in adults with multiple sclerosis. Also, there's an imperfection in the accuracy of the test, so few people testing negative, it could be a false negative. There are many factors that may contribute to the development of MS, including genetic, environmental, and lifestyle factors, and it's likely that multiple factors interact to increase the risk of developing the condition. If you have concerns about your risk of developing MS or your symptoms, it's important to speak with a healthcare provider to determine the best plan for managing your health. I feel like it has difficulty remembering my prior questions. I already said that I was diagnosed with MS. A lot of the answers are very prolonged. It could simply respond, many people get EBV infection but don't develop symptoms. Do you think it's related to diet? Diet may play a role in the management of symptoms in individuals with MS, but there is limited scientific evidence to support a direct link between diet and the development of MS. A healthy diet that includes a variety of nutrients and is low in saturated fat, salt, and added sugars is recommended for people with MS. Additionally, some studies have suggested that following a Mediterranean-style diet, which is high in fruits, vegetables, whole grains, and healthy fats, may be beneficial for individuals with MS. I find it interesting that it kind of gives a specific piece of advice, which is the Mediterranean diet, which is something that's sort of a diplomatic general answer. It's hard to say, in my opinion, there's better evidence for this than, say, the Terry Wahls diet, which has even randomized controls diets, or overcoming multiple sclerosis, which has some observational evidence. It's really hard to say that the Mediterranean diet has better evidence than those popular diets. So it's a very sort of generic and diplomatic answer. It's important to work with a healthcare provider and registered dietitian to determine the best diet for your individual needs, taking into account any specific health concerns, medication side effects, and other factors. It's also important to remember that MS is a complex condition, and many factors, including genetics and environment, play a role in its development. And I think maybe it's specifically programmed to say that just so that people don't take it as medical advice. I guess they don't want to get sued here. Have you heard about Dr. Terry Wahls? I heard she cured her MS. Yes, I am familiar with Dr. Terry Wahls and her story. Dr. Terry Wahls is a physician and researcher who was diagnosed with secondary progressive MS. She implemented a modified version of the Paleolithic diet, which emphasizes whole, unprocessed foods, and eventually began to walk without a cane. Dr. Wahls' story has been widely shared and inspired many people with MS and other chronic conditions to make changes in their diets. However, it's important to keep in mind that while Dr. Wahls' story is compelling, it is not necessarily representative of the experience of all individuals with MS. Additionally, while diet may play a role in managing symptoms for some individuals with MS, there is limited scientific evidence to support the use of a specific diet for the treatment of MS. The best approach to managing MS is to work with the healthcare provider to develop an individualized plan that takes into account your specific symptoms, medical history, and other factors. It's important to remember that MS is a complex condition, and there is no one-size-fits-all approach to managing the condition. While dietary changes may be beneficial for some individuals, they may not be appropriate or effective for everyone. I have to say, this is a very reasonable and well put together, though extremely hedgy and diplomatic response. What about the holism study and Professor George Jelinek? I am familiar with the holism study and Professor George Jelinek. The holism study is a research project led by Professor George Jelinek, a physician and researcher who has studied multiple sclerosis for many years. The study looked at the experiences of individuals with MS who followed a lifestyle program based on the Overcoming MS Recovery program, which was developed by Professor Jelinek. The program includes dietary changes, physical exercise, stress management techniques, and other lifestyle modifications, and is based on the idea that lifestyle factors play a significant role in the development and progression of MS. The results of the study suggested that individuals who followed the program had improved quality of life and reduced disability compared to those who did not follow the program. Exactly correct. Do you think vitamin supplements could help with MS? Vitamin supplements may play a role in managing symptoms in individuals with MS, but there is limited scientific evidence to support their use for the treatment of MS. Some research has suggested that taking high doses of vitamin D may be beneficial for individuals with MS, as vitamin D is involved in the regulation of the immune system, and low levels of vitamin D have been associated with an increased risk of MS. However, more research is needed to fully understand the role of vitamin D in the development and progression of MS. It is important to keep in mind that taking large doses of vitamin supplements, including vitamin D, can have adverse effects and may interact with medications. Therefore, it's important to speak with a healthcare provider before starting any vitamin supplement regimen, especially if you have a chronic health condition. So they could add in there that there's actually multiple randomized trials of vitamin D supplementation showing it was not beneficial. So there's actually a lot of evidence against vitamin D supplementation, in my opinion. They could also add there's some observational evidence that taking supplements with fish oil or omega-3 supplements, flaxseed oil, could be beneficial, at least based on observational studies. It is true that taking very high doses of vitamin D could be risky, although for moderate doses, the risk is extremely low. Keep in mind that for a fair-skinned individual like myself, I could get 10,000 international units of vitamin D literally in 10 minutes by going outside in a swimsuit in the middle of the day in the summer. So it's kind of silly that this would be a dangerous amount of vitamin D to take, at least for the typical person without a vitamin D sensitive condition such as calcium-containing kidney stones. What do you think is the best medication? There is no single best medication for MS, as the choice of treatment depends on various factors, including the type and severity of MS symptoms and the individual's medical history and overall health. There are several types of medications available for the treatment of MS, including disease-modifying therapies, which are used to slow the progression of the disease, and symptomatic treatments, which are used to manage specific symptoms, such as muscle spasms, pain, and bladder problems. Some of the commonly used disease-modifying therapies for MS include interferons such as Avonex, Rebif, and beta-seron, glutaramine acetate, natalizumab, Tysabri, fingolimod, Gilenya, alemtuzumab, Lemtrada, ocrelizumab, Ocrevus. I think it's interesting that there's sort of a bias in the medications listed. Like, why beta-seron but not Xtavia when they're the same formulation? Why did they put glutaramine acetate and list one brand, Copaxone, but not other brands such as Glatopa? I guess because Copaxone was originally FDA approved. Why this individual S1P phosphate receptor modulator, fingolimod, Gilenya, and not, saponamide, Mayzent, for example? Why Ocrevus and not rituximab or Kesimpta, for example? It's interesting. I think these may be the most Googleable disease-modifying therapies. Also, they don't make clear here that disease-modifying therapies actually have better evidence in terms of stopping new MRI lesions and relapses, and actually somewhat lesser evidence at slowing disability progression. I've seen some people with MS with significant disability. I don't care about side effects. I'm willing to risk death. What do you think is the strongest disease-modifying therapy? And it flags me. It thinks I'm suicidal. Clearly, I'm just saying I'm willing to take a risk for a medical treatment. But anyway, it's important to understand that while stronger medications may be more effective in slowing the progression of MS, they can also have more significant side effects. The choice of disease-modifying therapy depends on various factors, including the type and severity of MS symptoms and the individual's medical history and overall health. That being said, some of the DMTs have been shown to be more effective in slowing the progression of MS, include Tysabri, Lemtrada, Ocrevus. These are, in fact, stronger disease-modifying therapies, many of which have evidence in head-to-head trials. For instance, Tysabri was superior to Avonex in a head-to-head trial, Limtrada superior to Rebif, same with Ocrevus. It's important to keep in mind that these medications are not appropriate for everyone, and their use may be associated with serious side effects, including an increased risk of infection and other medical complications. Additionally, their use should be guided by a healthcare provider who is experienced in the management of MS and is familiar with your medical history and overall health. If you are considering using a stronger DMT, it's important to discuss the potential benefits and risks with your healthcare provider, who can help you make an informed decision based on your individual needs and medical history. Additionally, it's important to work with your healthcare provider to develop a comprehensive treatment plan that includes not only medication, but also other strategies for managing symptoms such as physical therapy, occupational therapy, and lifestyle modifications. So it seems to draw on a little bit and add excess information instead of just answering the question. What about stem cell transplant? Stem cell transplant, also known as hematopoietic stem cell transplantation, HSCT, is a treatment that involves replacing damaged or diseased cells with healthy stem cells in order to treat certain medical conditions, including MS. In the case of MS, the goal of the stem cell transplant is to reset the immune system, which is believed to play a role in the development of the disease. This is accomplished by destroying the existing immune system and then transplanting new stem cells that can develop into a new healthy immune system. It should clarify that chemotherapy medications are used to wipe out the immune system, and that the conditioning regimen is in fact the active treatment. Stem cell transplant is still considered an experimental treatment for MS and is only performed in a limited number of medical centers with experience in this type of procedure. Now, this is a very odd thing to say. Hematopoietic stem cell transplant has been used in MS for many decades. I wouldn't say it's experimental. There are many published studies on various conditioning regimens. We have a good sense for the safety and efficacy. It is true that it's not performed widely. The procedure is complex and carries significant risks, including risk of serious infections, organ damage, and even death. Certainly true. Additionally, while some studies have suggested that stem cell transplant may be effective in treating MS, more research is needed to determine its safety and efficacy. I would really disagree with that. On certain conditioning regimens, there are just numerous publications. There's very strong evidence that, for instance, Cytoxan plus ATG is very effective in treating relapsing MS. It's just that there are safety concerns. And it is not a widely accepted or routinely recommended treatment for MS at this time. And then there's sort of an additional conciliatory paragraph as usual. I heard there are different conditioning regimens with HSCT. Do you know about these? Yes, there are different conditioning regimens used in HSCT, also known as stem cell transplant. The specific regimen used can affect the success and safety of the transplant. The two main types of conditioning regimens are myeloablative high-dose conditioning. This involves using high doses of chemotherapy and or radiation to destroy the immune system and prepare the body for the transplant. Myeloablative conditioning is associated with more severe side effects, including an increased risk of infection and end organ damage. But it may also result in a stronger, more effective immune system after the transplant. It's not true that it results in a stronger immune system, but there's some evidence, for instance, observational evidence suggests that people receiving BEAM, which is a myeloablative stem cell transplant, may have a higher probability of extremely long-term remission than with, say, weaker regimens such as Cytoxan plus HEG. 2, reduced intensity or low-dose conditioning. This involves using lower doses of chemotherapy and or radiation to prepare the body for the transplant. Generally speaking, radiation is for a myeloablative transplant. Reduced intensity conditioning is associated with fewer side effects, but it may also result in a less effective immune system after the transplant. That is simply completely false. It has nothing to do with the strength of the immune system. The immune system should come back after the transplant. The choice of conditioning regimen depends on various factors, including the individual's overall health and medical history, the type and severity of the disease, and the availability of suitable stem cell donors. That's, of course, if it's a myeloablative transplant where you would require a stem cell donor. Generally speaking, in MS, it's typically autologous, in other words, not allogenic, not from a donor at all. So GPT is getting a little bit confused, and again, the last paragraph is a bit unnecessary. Dr. Richard Burt thinks non-myeloablative regimens like Cytoxan plus ATG is more appropriate for MS. Do you agree? As an AI language model, I do not have personal opinions. However, I can tell you that the choice of conditioning regimen for HSCT in the treatment of MS is a topic of ongoing debate amongst healthcare providers. Dr. Richard Bird is a well-known researcher and clinician who has studied and performed stem cell transplantation for the treatment of MS, and he has suggested that non-myeloablative regimens such as Cytoxan plus ATG may be more appropriate for this condition. Wow, exactly correct. I don't know if ChatGPT is copying me or actually got that information independently. Non-myeloablative regimens are associated with fewer side effects compared to myeloablative regimens, and they may be a better option for individuals who are not in good health or who have other medical conditions that increase the risk of complications from a high-dose transplant. However, it is important to note that stem cell transplant is still considered an experimental treatment for MS, and more research is needed to determine its safety and efficacy. Again, there are numerous publications on this topic, and generally speaking, HSCT, particularly with high-powered conditioning regimens, are regarded as being highly effective in relapsing MS, and this is not just personal opinion. This is based on numerous, even randomized studies like the MIST trial, but mostly observational studies. Of course, the safety of these drugs is extremely well known, both for MS and their use in other conditions like the treatment of cancer. Additionally, not all healthcare providers are experienced in performing stem cell transplant, and the procedure is only available at a limited number of medical centers. If you are considering stem cell transplant for the treatment of MS, it's important to discuss the potential benefits and risks of different conditioning regimens with your healthcare provider, who can help you make an informed decision based on your individual needs and medical history. Additionally, it's important to work with your healthcare provider to develop a comprehensive treatment plan that includes not only the transplant, but also other strategies for managing symptoms such as physical therapy, occupational therapy, and lifestyle modifications. How bad is MS? MS is a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. The severity of MS varies widely from person to person, and some people with MS may experience only mild symptoms, while others may develop significant disability over time. The symptoms of MS can be unpredictable and can change over time, and they can include, and I'll skip this and the last two paragraphs of the response and try to get it to answer the question. But how bad is it on average? What are my chances of being in a wheelchair? The course of MS varies widely from person to person, and it is difficult to predict the specific outcome for any individual. While some people with MS may experience significant disability over time, others may experience only mild symptoms, and some may have no symptoms at all. The likelihood of needing a wheelchair for mobility purposes can also vary widely depending on the type of MS, the severity of symptoms, and other factors such as age, overall health, and access to medical care. For some individuals with MS, a wheelchair may become necessary for mobility purposes if they experience significant muscle weakness, difficulty with coordination and balance, or other symptoms that affect their ability to walk. However, many people with MS are able to manage their symptoms and maintain mobility throughout the use of assisted devices, physical therapy, and other forms of rehabilitation. And again, there are a few sort of unnecessary paragraphs. It's not really answering my question. One way this question could be answered is to say, well, based on a study from the University of California, San Francisco, looking at people with relapsing MS, after 10 years, only about 5% even needed a cane. So for a young person with relapsing MS, the prognosis, at least in the short to medium term, is usually pretty good in terms of mobility. For people with progressive MS, there's a greater probability of greater disability. But I think that ChatGPT does seem to understand that it's a highly variable and unpredictable condition. I was thinking about taking Ocrevus. Is it safe to take with COVID still around? The safety of taking Ocrevus during the COVID-19 pandemic will depend on a number of factors, including your individual medical history, current health status, and other medical conditions you have. Ocrevus is a medication used to treat relapsing forms of MS. Like all medications, it may have side effects, and it's important to discuss the potential benefits and risks with your healthcare provider. One little error there is that Ocrevus also has an approval for primary progressive MS. COVID-19 is a highly contagious respiratory illness caused by SARS-CoV-2 virus, and people with underlying health conditions such as MS may be at increased risk for severe illness if they become infected with the virus. So it's actually not true that people with MS alone have an increased risk. B-cell depleters such as Ocrevus are well known to increase the risk, and many people, even young, healthy people taking Ocrevus, rituximab, Kesimpta, have been hospitalized with COVID-19. However, at this point in the pandemic, when I'm filming it, there are relatively low rates of severe COVID So for someone who is otherwise at low risk, just taking Ocrevus or a similar medication would probably not be at extremely high risk of severe COVID-19, at least not compared to before. Of course, talk to your own provider. So it gives a very diplomatic answer here, a very wishy-washy answer, which I can certainly understand. Maybe it's specifically programmed to answer COVID-19 questions in this way. Where is a good place to get information about MS? There are several reputable sources of information about MS that you can use to learn more about the condition, treatment options, and resources available to help manage the symptoms. Some of the best sources of information about MS include National MS Society, MS Association, I think they're trying to say MSAA, MS Association of America, National Institute of Neurological Disorders and Stroke, Mayo Clinic, MS International Foundation, your healthcare provider. It's important to remember that the information you find online should be reviewed by a healthcare professional, and to always discuss any questions or concerns you have about MS with your doctor or other healthcare provider. Are there any good YouTube channels about MS you recommend? Yes, there are several YouTube channels that provide information and resources about multiple sclerosis. Some of the most reputable channels include MS Association, MS Views and News, MS Society of Canada, National MS Society, MS Learn Online, MS Active Source. It is important to note that not all information you find on YouTube is accurate or scientifically based, and it's always a good idea to discuss any questions or concerns you have about MS with your doctor or other healthcare provider. What about Dr. Aaron Boster? Is he legit? Dr. Aaron Boster is a neurologist and the founder and medical director of Ohio Health NeuroHealth, a center for the treatment of neurological disorders. He is a well-respected specialist in the field of MS and has published several articles and studies on MS and other neurological conditions. In general, it is always important to consult with a qualified healthcare professional when seeking information and treatment for a medical condition such as MS. Dr. Boster is a licensed and qualified healthcare professional and is well regarded in the field of neurology, but it's important to evaluate the suitability of any doctor or treatment plan for your individual needs and circumstances. I took a screenshot of this and sent it to him instantly. What incredible praise. He has really hit the big time. What about Dr. Brandon Beaber? I'm not able to find information on Dr. Brandon Beaber in my training data. It is possible that he is a healthcare professional, but without more information, it is not possible for me to determine his qualifications or expertise. Ow, that is ice cold. I definitely have to up my game. Maybe that's my goal by 2025 to be recognized by ChatGPT. Okay, so how did ChatGPT do overall? Am I on the chopping block, about to be replaced by AI pretty soon? I'd be interested to know what you think in the comments below. I'll sort of break it down by category. In terms of natural language processing and interacting like a real human, let's be honest, it was horrible. F-, it's giving these long, ridiculous, robotic responses, saying the same thing over and over again, giving these like counseling type responses over and over again. They really definitely have to work on responding more reasonably. Maybe it could give a one-line response and ask for further information, or give me a chance to go back and forth with it. It really didn't come off very naturally. Now, I think it was very good at recognizing what I was asking. It picked up on a lot of different things, like the questions about Epstein-Barr virus, about stem cell transplant. I think it did very well, and it gave reasonable responses most of the time. Very diplomatic responses, maybe the kind of thing you would see on the National MS Society. And I understand it's not going to give an opinion, it's going to give sort of a generic, typical answer to a question. However, I didn't really see any intelligence. I didn't really see it synthesize anything, create anything. It essentially gave an answer based on what you would find in Google search, looking at the top few links from a reputable source. It did kind of understand the question and put together an answer, but it didn't take information from a lot of different areas. And I think that's something that really true generalized artificial intelligence should be able to do. When I say, how bad is multiple sclerosis? It should be able to draw from multiple scientific publications and be able to really answer that question and provide real data. And it just simply cannot do that except to say it's highly variable. In terms of accuracy, I think it was fairly accurate. There are definitely some errors there, but it's maybe like 80, 85% accurate. And hey, in my videos, there are errors too, so computers don't have to be perfect. They just have to be better than human physicians to essentially replace us. And, I think it did pretty well overall. Is it actually like on the verge of replacing doctors? I don't think so. I don't think it's even close to that, because you can just put those questions into Google yourself and you can just find what link is appropriate and get some decent answers to your questions and look at articles written by humans, because that's ultimately what ChatGPT is doing. Again, it's not creating or synthesizing anything. It's not real generalized AI. It just has a superior ability to prior artificial intelligences to kind of recognize your question and find an appropriate response and create something reasonable in terms of language. But I'd be interested to know what you think. Were you impressed by it? Were you not impressed? How close do you think we are to maybe being able to use artificial intelligence? We are actually using artificial intelligence a little bit in medicine. For example, in radiology, in reading mammograms, computer-assisted diagnosis looks to flag certain areas of abnormalities that the radiologist reviews. It's very oversensitive. It picks up a bunch of junk and the radiologist says, yeah, that's not a mass. But it may occasionally help the radiologist find something they might otherwise miss. It's used to help with research to look for patterns and correlations in epidemiologic data and in healthcare medical records. It's used to find if a patient needs a certain screening test, for example, and recognize misses and, just help us improve our medical care. But it's more like specialized AI. It's more like the equivalent of computer chess, making a specific program do something specific for a planned need. This attempt at generalized artificial intelligence, I think we're a little bit far away, but hey, maybe contribute to the 401k just in case. You never know when we all might be replaced. My friend actually thinks not only will you be unemployed, essentially almost everyone will be unemployed. That's how optimistic he is. I think it's a little bit far-fetched. But anyways, this was a fun, silly video. I hope you enjoyed it. Let me know if you have suggestions for more serious videos about MS going forward.